The Harrow Dental team have taken greater measures to minimise our patient contact times within our surgical environment. Patients will be contacted by a reception team prior to their appointment. Following the verbal confirmation of their medical history, they will be given a comprehensive overview of how the appointment will take place while maintaining social distancing. Instructions will be given to our patients to wait in their car until the appropriate time of their appointment has arrived. They may approach the door, buzz and alert their presence to a member of staff within the practice. They will be kindly asked to step back and have their temperature taken with our radar thermometers. As long as the patient's temperature is below 37.8 degrees and have no symptoms of COVID-19, they will be welcomed into the practice and asked to cleanse their hands with alcohol hand rub. The patient will then step onto the hypochlorous acid pads to disinfect their feet and will then be instructed on how to place a fluid-resistant surgical face mask by creating a seal around the bridge of the nose. In addition to the mask, the patient will be given a plastic bag to place the mask inside while in the surgery. Payments will then be taken in advance of entering the surgery. The PDQ card machine will be disinfected after each transaction. The reception area will be comprehensively wiped down at the end of every session. The patient will then be guided to a hand washing station to use detergent and warm water to fully cleanse their hands before entering the surgery. After hand washing, patients will dry their hands and dispose of the hand towel themselves into the clinical waste bin. After comprehensive hand washing has been completed, the patient will place their belongings inside a plastic box before entering the surgery and taking a seat. Once seated, the patient will then be asked to remove the face mask and place it directly into the provided plastic bag, which will remain inside the bag for the duration of the procedure. A hydrogen peroxide mouthwash will then be used for 60 seconds prior to any intraoral procedures that are to be carried out. This is then followed by placing the personal protective equipment, including well-fitted safety glasses and a patient bib. Instrument trays and consumables should be individually packed where possible to avoid cross-contamination and opening of the drawers. Intraoral radiographs will be passed over to the buddy nurse for processing, followed by a change of gloves to prevent cross-contamination. On completion of the procedure, the patient will remove their personal protective equipment and replace it with their fluid-resistant face mask for the duration of their time within the clinic. The plastic bag can then be disposed of before the patient will be asked to carry out a final hand disinfecting procedure whilst they are still in the surgery. On retrieving their personal belongings from the plastic box, the patient will be greeted by a member of staff and then escorted back to the reception area. On exiting the practice, the patient will be asked to dispose of their fluid-resistant surgical mask into the clinical waste bin near the door, prior to using the alcohol hand rub and then exiting the practice under the guidance of a staff member. The terminal clean will involve hypochlorous acid fogging, which should be done 3 times a day prior to opening, lunchtime and the end of the day. Hypochlorous fogging is an effective physical method of preventing further spread of virus by spraying down all surfaces. The terminal clean should involve disinfection of all door handles and the plastic box which the patient has come into contact with, including the main entrance and the handles of the surgery. This should ideally include the outside and the inside of the box. During the visit, patients will notice every environment is equipped with the air purifier system and virus killer, which is proven to kill viruses up to 99.99%. Providing clean air every 5 minutes. In addition, the use of a very powerful extra vacuum suction for aerosols and droplets will be used for procedure and kills 99.9% of viruses.